Have you ever wondered if your child's worries are simply a phase or something more serious? I'm Sia, your science-informed assistant and narrator at Empathic Psychologist, and today, we're unlocking the science behind childhood anxiety. Imagine overhearing your child whisper, "What if something bad happens?" How do you know if it's normal or if it's time to act? That's where we come in. Today's episode will give you a clear roadmap. We'll break down the difference between everyday fears and clinical anxiety, explore the most telling symptoms, and walk through evidence-based strategies for support. You'll learn about terms like developmentally appropriate fears. Think of these as nature's way of teaching caution, as well as pathological anxiety, which is like a smoke alarm that won't stop ringing, even when there's no fire. By the end, you'll know what to watch for, how to help, and when to reach out for professional guidance. Let's start our journey to understanding, empowerment, and resilience together. Let's start with a question. Is your child's fear of the dark something to worry about, or just another milestone? Many parents find it tough to decide. Normal childhood fears, like separation anxiety in toddlers or fear of the dark around age 2 or 3, are actually evolutionary safety features. They help kids learn to navigate the world. But when fear lingers beyond the expected age or starts to take over daily life, we're moving into the territory of clinical anxiety. Think of duration and impairment as your compass. If worry lasts more than 4 weeks and disrupts routines, it's time to pay closer attention. You might ask, is this just a phase or something serious? The answer lies in observing intensity and persistence. It's not about a single tantrum, it's chronic avoidance or distress. Just like a fever might signal an infection, persistent anxiety signals the need for action. Understanding this distinction is your first step towards effective support. Children often can't say, "I'm anxious." So, how do we spot the hidden struggle? Emotional and cognitive symptoms are your early warning lights. Watch for constant worry, feelings of helplessness, irritability, or negative self-talk, like when your child says, "I can't do this," or "everyone will laugh at me." These thoughts don't always surface, but they drive anxious behaviors. In psychology, we call these automatic negative thoughts. Imagine them as pop-up ads your child can't close, and catastrophizing, which is like turning a small homework mistake into a full-blown disaster movie. Are you seeing sudden mood swings? Or your child seeming down for days? Those could be subtle signs of anxiety quietly taking root. Recognizing these patterns early lets you step in before anxiety grows into something more disruptive. Have you ever seen your child clutch their stomach before school, or complain about headaches with no clear cause? Anxiety doesn't just live in the mind, it's a full-body experience. Common physical symptoms include stomach aches, muscle tension, headaches, and trouble sleeping. These are the body's fight or flight alarms going off. Think of cortisol as the body's internal fire drill, sounding even when there's no real emergency. Sometimes, you might wonder, are they just trying to skip school? But for anxious kids, these aches are very real, even if doctors find nothing wrong. Another term you'll hear is psychosomatic. That's when emotional stress shows up as real, physical pain, much like a computer freezing when overloaded with tasks. Noticing these symptoms early can help you connect the dots between what's happening in your child's mind and body. How do anxious children show us what they can't say? Often, it's through avoidance, stepping back from feared situations, or seeking constant reassurance. Some kids refuse to go to school, avoid sleepovers, or insist on sleeping in your bed. Others ask the same "what if" questions over and over. This isn't just stubbornness. It's anxiety's way of trying to gain control. Behaviorists call this safety-seeking behavior. Think of it like using training wheels because you don't trust the bike yet. Alternatively, escape behaviors are when kids run from discomfort rather than face it. You might ask, are they just being difficult? But these patterns are usually signals that your child feels overwhelmed and unsafe. Understanding these behaviors helps you respond with empathy, not frustration, and supports your child where they need it most. Does anxiety look the same in a 5-year-old as it does in a 15-year-old? Absolutely not. Let's break down how symptoms shift with age. Younger children often act out their anxiety physically, think frequent crying, tantrums, or clinging to caregivers. It's their way of saying, "I'm not okay," even if they can't find the words. Adolescents, on the other hand, tend to internalize. You'll see social withdrawal, irritability, or preoccupation with fitting in. The technical terms here are externalizing behaviors, actions directed outwards, and internalizing behaviors, where distress turns inward. Picture a spectrum. At one end, meltdowns and tears. At the other, silent suffering. Recognizing these differences ensures your support is age-appropriate, not one-size-fits-all. Let's zoom in on separation anxiety disorder, the most common anxiety disorder in young children, especially around age 7. If your child melts down at drop-off or won't sleep alone, this might sound familiar. This isn't ordinary homesickness. Children with separation anxiety are plagued by worries about their parents' safety or their own, and experience intense distress when apart. Clinicians use terms like hyperattachment, where kids are like magnets, unable to separate, or anticipatory anxiety, worrying about something before it even happens, like dreading school days in advance. If you've found yourself planning your entire day around your child's fears, you're not alone, and there are proven ways to help. Spotting this early allows for targeted support, reducing long-term disruption for both your child and your family. What if your child freezes up in group settings or refuses to speak at school? Social phobia, also called social anxiety disorder, often emerges between ages 11 and 15, right when peer interactions become crucial. This isn't just shyness. Kids with social phobia fear, embarrassment, or negative judgment so intensely that they avoid normal activities. Terms like performance anxiety, worrying about how they appear, and selective mutism, where children literally can't speak in certain situations, are key hallmarks. Imagine your child is invited to a party and responds with panic or tears. It's not about rudeness, but a genuine fear response. Recognizing these behaviors can prevent isolation and foster healthy, confident social growth. Is it really urgent to address childhood anxiety? Or will time heal all wounds? Evidence is clear. Early intervention changes lives. Untreated anxiety in childhood can lead to depression and academic struggles down the line. Imagine anxiety as a weed. Pulling it early means fewer problems later. Psychologists talk about risk trajectories, the paths children follow if challenges go unaddressed, and protective factors, like family support, that buffer against risk. You might wonder, is it too soon to get help? The answer is no. Early support not only eases distress now, but builds emotional resilience for the future. Taking action early is a powerful gift you can give your child, setting them up for long-term well-being. So, what actually helps anxious children? The clear winner is cognitive behavioral therapy, CBT. But what does that mean for your family? CBT teaches kids to spot unhelpful thoughts and challenge them, like reprogramming a GPS that always sends them down the wrong road. Therapists use exposure techniques, gradually facing fears in small steps, similar to learning to swim by dipping in a toe, then wading deeper. They also teach relaxation strategies, such as deep breathing, which works like a reset button for the nervous system. You might ask, will my child just outgrow this? With CBT, they don't just cope, they learn tools for life. Choosing evidence-based therapy means you aren't guessing you're following a proven roadmap to healing. What can you do right now as a parent? You're not just a bystander. Your involvement is vital. Start by establishing predictable routines, the psychological equivalent of guardrails on a winding road. Next, validate your child's feelings without feeding the fear. I see you're scared, but I know you can handle this. Use positive reinforcement, rewarding even small acts of bravery, which acts like putting coins in your child's emotional piggy bank. And model calm behavior, because children learn by watching how you react under stress. You might wonder, Am I reinforcing the anxiety by accommodating? The key is to acknowledge the fear while encouraging small, manageable steps forward. With empathy and structured support, you become your child's greatest ally on their journey to resilience. Let's bring it all together. Childhood anxiety can feel like a maze, but with clear signs, early action, and family-centered strategies, you can guide your child through. Remember, 1. Early recognition of symptoms is crucial. 2. Evidence-based approaches like CBT are highly effective. 3. Your family's empathy and consistency make all the difference. So, what should you do next? If you're noticing these signs in your child, reach out to empathic-psychologist.com for a confidential assessment. It's a proactive step that can change the course of their life. And here's a teaser. In our next episode, we'll dive into how parents and schools can partner to manage childhood anxiety and explore strategies to ease anxiety. In the classroom, real tools for real families. Please follow us on your favorite platform, share your feedback, and send us your questions for future episodes. Remember, you're not alone on this journey. Empathic Psychologist is here with you every step of the way.